I got asked the other day, what is the one thing that I can do to help prevent type 2 diabetes? Welcome to drashori.com. My name is Dr. Ashori. I'm a board-certified family medicine physician, and I talk about healthy aging for those in their 30s and 40s to prevent chronic diseases, live well, prosper, have vitality, and be disease-free. We know that diabetes is incredibly common, and it is perhaps becoming more common in our community due to inactivity, dietary availabilities in our environment. And it's rarely the fault of the people who are developing diabetes. That's very important to understand, because it's the food environment and the overall environment that contributes to it. So if I did have to pick one thing, which I wouldn't, there's many different things you can do to help decrease your risk of type 2 diabetes. If I had to pick one thing, it would be to make sure that your endocrine function, your metabolic function is healthy. There are probably 3 tests that you can do that is incredibly effective for that. One of them is a fasting blood sugar. The other one is a fasting insulin level. And another good marker might be your triglycerides. And I think fasting triglycerides will suffice. This is a good indication of what your metabolic function is. If you didn't have any of that, if you're exercising, if you're active overall, if your body weight is within a normal range, and if your stress level is decent, chances are the risk of you developing diabetes will be incredibly low. If these blood tests that I mentioned are also good, chances are you'll prevent type 2 diabetes in the future. Now, testing these is not enough, because when you test them in 2025, it doesn't mean that in 2026, 2027, these numbers are not going to be abnormal. So still, when looking upstream of this problem of preventing type 2 diabetes, it is your habits, it is your behaviors, and it is your choices. Fortunately, type 2 diabetes is a cumulative process. It's multiple attacks and insults on your metabolic function that eventually lead to the insulin from the pancreas not functioning the way that it should, the cells, especially the muscles, not being able to uptake glucose, the liver having too much damage for it to actually manage your gluconeogenesis. So a lot of problems develop. Making small choices on a daily basis is incredibly effective. One better food choice every day, a little bit of activity, making sure that if you carry extra weight, that it's either compensated by a lot of muscle mass or that you lower the visceral fat in your body. You can do a DEXA scan to figure that out. That would be the most effective way to prevent type 2 diabetes. If you want to check out other videos, I have other ones about diabetes. Check those out. If you want more information, go to drashori.com.